Brazilian butt lift has become really popular over the last several years, and I think probably not in a small part as a result of Kim Kardashian's sort of fame for the size of her butt. What a Brazilian butt lift is this: we do liposuction, we take the fat, and instead of throwing it away, we process it. There's a number of ways of doing that, and then we inject it back into the butt. Historically, the way we would make a bottom bigger is with silicone implants. The issue is you're putting your body weight, you're sitting on these implants all day, and a fair enough percentage of those patients, the implant sort of will do what we call an extrusion. It'll actually come out through the skin. Unlike breast implants, we're not really putting pressure on them. You can have breast implants in for 50 years, and it's very uncommon for breast implants to come out through the skin. But you can imagine putting your full weight on your bottom all day for 8 hours a day if you work at a desk, and that pressure against a foreign object, it can be a recipe for some problems. So years ago, somebody said, well, we take fat and move fat around the body for other reasons. We put it in the face, we put it in the breast. Why not try using it in the buttocks? And it became very popular in Brazil, hence Brazilian butt lift. So the procedure takes several hours. It usually starts off with somebody having liposuction at the front part of their body. We harvest the fat. We then turn them over, continuing liposuction the back part of the body, processing the fat. Usually we have sort of a team approach, so there's always some work being done. Then we make a bunch of small incisions around the periphery of the bottom, and then we add a volume that's sort of consistent with what the patient's trying to achieve. There are limitations, the same way we've talked in the past about limitations with breast implant size. You can only put a certain, you can only put a size, you can't put a size 6 body in a size 4 dress. So people might come in and say, well, I want to go from where I'm now to this massive butt. Well, you don't have the skin to stretch out to that much of a change. So what part of the consult is establishing a person's goals, but then it's also doing the physical exam and figuring out what are they really a candidate for, how much of a change can they accommodate. If they have a lot of laxity to the bottom, we can probably put in a substantial amount of fat, assuming they have a substantial amount of fat to harvest. If they have a more dense bottom that doesn't have as much elasticity, we're going to put less in. But the two big factors are you have to have a donor site, you have to have fat that we can gather, and then you have to have a good target to put it into. So that's really the consult consists of, once we've established what your goals are, we look at your body and find out where is there fat to take and what's the area look like they're putting into. So when somebody comes in, they're 5 feet tall and weigh 100 pounds, they're not going to be a great candidate because that person isn't hiding fat to use. They may want a fuller bottom, but they don't have the fat to transfer. We need somebody who has, had some extra fat on the belly or the lower back or the thighs that we can take and utilize. The beauty of that procedure is you get two things out of it. For the ideal patient, you get the improvement that the liposuction gives you. So maybe you didn't like your inner thighs or outer thighs or belly. Well, those areas now look better from the liposuction. On top of that, you get the fuller bottom. So, the worst case scenario, even if the bottom doesn't give you the result you were hoping for, you still get the benefit of the liposuction sites. In an ideal world, both parts look great. But it's one of those procedures that, gosh, there's two opportunities to make this patient really happy. So it can be a lot of fun to do.